Hi everyone, it's Rania. So for those of you who don't know me, my name's Rania and I'm a second year nursing student. So this week I just completed my first week of year 2 clinicals and I would have loved to take you along with me, but for obvious reasons I couldn't do that. So instead I decided just to film myself after each shift and just kind of explain to you what I did that day. So try to stick around till the end where I talk about what was probably the most heartwarming patient experience that I've had yet. I'm not kidding, it literally brought me to tears. So this video is going to be different from my other ones because it's a lot more relaxed. It's probably more like vlogish, like, I suppose. Anyway, if you like it, please, there's my dog. So if you like this video, please give me a thumbs up and subscribe if you haven't already. Thank you so much for watching. Charlie, say hi. Charlie. 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 Alright, so please don't mind how ugly I look right now. I just finished clinical. I've been wearing a mask all day and a face shield all day, and I'm just dirty and gross, and I cannot wait to go home and eat. Today started out a little bit rough. I was driving to the hospital and I missed my exit because someone wouldn't let me in the lane to turn. Someone wouldn't let me turn into my lane. And normally I'm a pretty aggressive driver, but it was pouring rain today, so I decided to be safe rather than sorry. So I was a little bit late because of that, and then got to the hospital, met up with my group and my instructor, and then realized that my ID badge had fallen off my bag. And I told my instructor, and she's like, well, I think you should go find it. I'm like, you want me to go running through the rain and run around that parking lot trying to find my ID? And she's like, yeah, I think you should. So I did. I ran through the rain, looking around the parking lot, trying to find my ID, couldn't find it. So yeah, I ended up being like 20 minutes late to clinic. But what are you gonna do? The rest of the day was all right. So she spent the first couple hours like orienting us to the unit and just talking to us about stuff. And then like 2 hours in, we got split up and we went off with our buddy nurses. And my nurse had 4 patients. 2 of them were total care. One was like semi-independent, the other one was independent. So it was a pretty easy day because she had already done the care for one of the total care patients before I'd even gotten there. So I only really helped her with the hygiene and stuff for just one patient. So I had a pretty easy day, just long but not difficult. And then what else? One of our patients though, he was new on the unit and violent and aggressive. Security ended up having to be called and guarding his room or just following him around the unit really, because he was just up to mischief. He swore at me. He called me an effing So there's that. That was probably the most exciting thing that happened to me. I got swore at today. Sworn? I don't know. Yeah, that's about it. What else? Oh yeah, so today we had buddy nurses, but tomorrow we're on our own with our own patients, and we were assigned our patients today before we left. So I'm pretty happy about the patient that I was assigned because my patient is independent. All she has is like a fractured humerus, so I'm pretty happy about that. I mean, I'll miss out on doing all the hygiene, but I'm okay with that because I don't want to do that. So yeah, I'm pretty happy with my patient. My second clinical day, and it was a very, very long and tiring day. Not because I was busy. In fact, it was the contrary. I was not busy at all. So I think I forgot to mention in yesterday's video where my placement is. So this semester I got placed on a geriatrics unit in one of the hospitals in my city, and I am not excited about this at all. So I love seniors. They're the whole reason why I decided to go into nursing, but just my entire first semester clinical was in long-term care, and part of my second semester clinical was in retirement. And then on top of that, I've been volunteering with seniors for the last 4 years, so all I know is seniors. And it would be so nice to work with another population. I don't know why I keep getting stuck in geriatrics. So at the end of yesterday's video, I mentioned that I was excited because my patient is fairly independent. All she has is a broken humerus. And I was excited about that because I didn't want to be doing hygiene or any kind of care because I'm just lazy. And now I regret that. I am not excited about this at all. She's really nice, love my patient, but she's independent. She requires so little care that I do nothing. I'm not learning anything. I look at my classmates, well, like my clinical mates, there's 3 others besides me, and their patients require a lot more care than I do. All through the day, they're doing all kinds of stuff. Me, on the other hand, all I had to do was in the morning hand my patient just a cup of oral meds, and that was it. I was pretty much done. So it's Sunday, October 25th, I think. I just finished my 4th clinical shift, which concludes my first week of clinicals. I didn't record anything yesterday because I figured I would just fill you in on it today. So today we were assigned a second patient on top of our initial patient. So now I've got 2 patients that I care for. Today was actually definitely the most exciting out of all my clinical days that I've had so far. I got to actually do things. I'm just gonna pull over here at a dead end and just talk before I get home, because as soon as I pull into my house, my dog's gonna go insane. So I'll just finish it here. Yeah, so today I got to do 2 sub-Q injections, which was kind of fun. They're my first injections that I've done. It would have been a little bit more fun though if they're intramuscular, because I think it'd be really cool to feel the needle going through the different layers of the skin. But anyway, that's okay. So I did a couple sub-Q injections. I got to take out staples, which was really cool. The teacher asked me if I wanted to do it, and I was just like, yes, like finally I can do something cool. I've been waiting for this forever. So I did that. I felt like, oh my God, my heart just really went out to this patient. I felt so sad for her. So because it's COVID, patients can't have visitors. So this poor woman is isolated on this floor with no visitors. She doesn't speak any English, and the staff don't speak her language either, so she can't communicate with anyone. But she speaks Mandarin. So after we removed all the staples, she asked 多少, which means how many, and I understood that. So in Mandarin, I told her that we took out our 16, which is 26. And oh my God, this woman, when she realized that I understood her language, or like kind of, not really, but I understood a little bit, she started like, oh my God, I'm gonna start crying telling the story. But she started crying and kissing my hand. Like she was so happy that she was able to, oh my God, I'm actually gonna start crying. My eyes are so watery right now. So she was so happy that like someone on that floor could finally understand her. Like she just started crying, she started kissing my hand and thanking me. And then she kept going on in Mandarin, and I was just like, no, I'm sorry, like I don't speak that much. Like I don't understand what you're saying. All I understood was that when she asked how many. But yeah, like my heart really went out to her. I feel so sad for these patients who are alone. One, they don't have, like one, it sucks for everybody to not have visitors, but on top of that, to be in a foreign country where you don't speak the language and the staff don't speak your language, just, I can't even imagine how isolating that is. I actually had an experience too where when I was in China, I needed hospitalization too, and I didn't speak Chinese and the doctors didn't speak English, so I do kind of understand what that's like, but at the same time, like my trip to the hospital was much quicker than her trip to the hospital. I can't even, like, I can't imagine that loneliness that she felt. So anyway, yeah, today was really good. I got to do a lot more stuff than I've done in the last few days, and I really enjoyed today. I had a really, really great day, and I am just exhausted now. I can't wait to go home and sleep. So this is my 4th day of clinical. We have class Mondays, Thursdays, and Fridays, and clinical Tuesday, Wednesday, Saturday, Sunday. So I am exhausted. I still have a Zoom meeting at 4, like it's 3:35 right now. So I have a Zoom meeting at 4, and then I'm gonna eat and just take it easy. And tomorrow, I'm not doing anything tomorrow. I don't even care that I have stuff to do. I am sleeping in, and that's it.